Welcome to Mondays with the Midwife. I'm Regina Kaiser, certified nurse midwife, doctor of nursing practice, and co-owner of Breathe Birth and Wellness. Today, I'd like to talk to you about some of the rights of childbearing women. Many of you have heard about the Patient Bill of Rights in your past, and I thought it would be helpful to discuss the rights that women have in pregnancy. Women in pregnancy have rights surrounding autonomy, privacy, and freedom from discrimination. First, I would like to discuss a right that's unrelated to your health care and that it pertains to your employment. It's defined as the Pregnancy Discrimination Act. This act makes it illegal for businesses with over 15 employees to discriminate against women because of pregnancy. Women who are pregnant must be treated like similar applicants and in the same manner as applicants that have similar abilities. Additionally, the Family Medical Leave Act ensures that companies with over 50 employees, which you've been employed with for over 12 months, are required to allow you 12 weeks of leave. So if you desire to take that full 12 weeks off with your baby, you should have these protections. However, you may have just be aware that you may have to do this without pay because that's not a requirement. Let's move on to your health care rights in pregnancy. A webpage that does a great job at helping women understand their health care rights in pregnancy is the Childbirth Connection. A document that they have entitled The Rights of Childbearing Women breaks down and helps women to understand their rights in labor and pregnancy and what is actually protected legally. I found it really interesting. They have about 20 of them, and I would like to share with you 10 and encourage you to visit the Childbirth Connection to help you learn more and to become an informed consumer. Let me preface this discussion by saying that healthcare providers are also entitled to refuse care to patients that desire care that they're not comfortable providing. So, communicating your desires openly with your provider, forming a trusting partnership, and just expressing your choice as someone that respects you and your choices will lead to ultimately a more satisfying experience for you both. So the first one I want to talk about is that women have a right to health care prior to pregnancy, birth, and after childbirth. So we have the right to receive care that is consistent with current data, scientific evidence, and practices that are found to be safe. These should always be used when indicated. That falls within a woman's right for informed consent. Likewise, interventions that are shown to be harmful to women in pregnancy, that are ineffective and unnecessary, should be avoided unless there is a medical reason. An example of this might be if we break your amniotic sac while you're in labor and your labor is progressing. There's not really a clear indication that any intervention is needed at that point. Every woman also has a right to choose the provider of her choice, a physician or a midwife, as both are skilled in normal pregnancy. Providers that are skilled for complications are also necessary so that all women have the available medical care that's necessary. Every woman has a right to choose her birth setting from what options that are available in her community, given that they've been giving the proper information about risk and benefits and cost of each. All the available options, whether that mean delivery at home, a birth center, or a hospital setting. Women also have the right to leave their maternity provider in the event that they're dissatisfied with their care. Every woman has the right to have their family members, friends, whoever they want present at their birth and in labor. And every woman has the right to receive continuous social, emotional, and physical support in her birth. Did you realize that women also have the protected right of freedom of movement in labor and to give birth in whatever position that they choose? Every woman also has the right to have uninterrupted contact with her baby, especially if neither of them requires separation for treatment that's medically necessary. And finally, women have the right to receive complete information about the benefits of breastfeeding. They may refuse actions that interfere with breastfeeding, like the use of pacifiers or unnecessary supplementation with bottles, if it's not medically indicated. These are only a few of the protected rights of childbearing women. If you would like to learn more, I highly encourage you to visit Childbirth Connection at childbirthconnection.org, where you can find out information about all of your pregnancy needs. Additionally, you can go to the Office of Women's Health at womenshealth.gov for additional support. Next week on Mondays with the Midwife, it'll be Christmas Eve, and we will talk about our mission at Breathe, and we'll reveal the organization that we're going to make our charitable donation to for 2018. We hope that you'll join us, and we're happy that you came to see us tonight. Have a great evening.